In this lecture, we are going to discuss a very important bone pathology, osteomyelitis. Before that, let me clear a very basic doubt about osteitis and osteomyelitis. See, there is a osteitis in the titis is used as a suffix in these both two words, so it suggests you that it's an inflammatory lesion. Osteitis is when there is an inflammation of cortex of bone. Cortex is basically the outer part of the bone, and osteomyelitis is inflammation of medullary component, also known as bone marrow of the bone. It may or may not involve cortex, but it will always involve the bone marrow of the bone. So osteomyelitis is basically the more severe form of cortex, the severe form of osteitis. So what are the causes for this particular disease? What is the etiology for this particular disease? To understand the etiology, let's first discuss pathophysiology of osteomyelitis. With this, the etiology will be clear. To understand pathophysiology, we know that it's inflammation, it's bacterial infection, start with bacterial infection basically, right? So because of certain regions, because of certain causes, the bacteria travels to the jawbone, right? So there is bacterial infection. For example, especially in say in your jaw lesions, you can have a carious tooth or any periapical pathology, right? You can even have a fracture or soft tissue infections like space infection, correct? You could even have like not even your jaw lesion, you have any secondary lesion to any lateral lesion, for example, some cancers, right? Or you can even have decrease response, like decrease immune response. Maybe patient is on steroid or on immunosuppressive drugs because of any recent transplant, organ transplant, or say there's any bacteremia in body, which is nowadays not common because of abundant amount of antibiotic available in the market, but it's still one of the main cause. Right, so and so regions you have a bacterial infection within the localized within the certain region, and this bacterial infection is inoculated into the jawbone. How? Because of these regions, and you like you are curious truth, and you did the extraction or you did the RCT or any traumatic injury. Because of that, the infection is traveled to your jawbone. That's why it is not advisable to do extraction when there is a swelling or there is a very severe papical abscess or infection. And even if you do that, you are supposed to do a very thorough curettage of the surrounding area. Correct. So see the inoculation in the jawbone. So what will happen? Bacteria is within the jaw and it will cause acute infection. And if there is acute infection, what you will have in here? Increase PMN or basically your neutrophil in your histology in your bone, right? So when you draw the histological diagram of osteomyelitis in the acute phases, you will have PMN, and in chronic phases, you will have leukocytes, right? So if you want to draw the histology, it's very simple. Just draw the bone, put huge amount of PMN in there, correct? So there is acute infection. This acute infection acute inflammation basically. This acute inflammation, what will happen? These PMN, what they will do? They will come and digest your or phagocytes your bacteria. And when bacteria phagocytes when PMN phagocyte the bacteria, right? For example, this is your phagocyte, and this is your PMN, basically neutrophil, and within it, this is your bacteria. This is PMN or basically neutrophil, right? What will happen? This will burst because it's full now, and this bursting of neutrophil will form pus. So presence of a pus is not your bacteria, it's just debarys of the bacteria and a lot of dead neutrophils. It's basically a graveyard for your neutrophils, right? All of the soldiers which sacrificed themselves for your body, these are that's pus, right? So there's a lot of amount of pus within your stimulated within the lesion. So what you do when you want to draw the histological diagram, you just draw the bone, right? And within the bone, you're going to show a lot amount of PMN, and you will show some amount of dead bone, right? And in the dead bone, we can just show some amount of pus or some amount of dead tissue in there. This pus, what it will do? It will increase pressure within your bone, correct? And if there is increased pressure within your bone, because of that, you will have stasis or decreased blood supply or basically clog your capillaries basically, right? Clogging your capillaries. If it's clogging your capillaries, so you can draw some capillaries, small bursting capillaries, which will burst. These capillaries, because of this, what will happen? There is ischemia. If there is ischemia within your bone, what will happen? This ischemia will form necrosis of is necrosis of bone. And if there is necrosis of bone, you can always do it like any dead bone present there. So see, if we read the anatomy of the bone, we know that this is our bone, correct? And within this bone, there is a part which is known as the cortex. This part is your cortex, and in the cortex, you have your medullary component, basically your bone marrow. This is your bone marrow. This part is cortex of your bone. And in the cortex, there is a small thin layer is lying, this protecting this layer. This is periosteum. And there is also a layer which is protecting the inside cavity, which is known as endosteum. Correct. So the infection is going on in this region, which is spread out. Now it's causing a lot of pressure, and because of that, it bursts into here. Correct. Infecting your cortex. That's why osteomyelitis may also involve cortex of your bone. That's why it's resolving your bone. If this thing will continue to grow, see this whatever this cyan color it, this everything is your infection, right? So for example, you have in certain cases you just have a overlying periosteum. Eh, Under the periosteum you will have infection or necrosis of bone, right? So two way. There is overlying periosteum, and under which you will have a small abscess. Right? Periosteum is still intact. This particular osteomyelitis stage is it's known as broody abscess. Correct. There is a peristeum under which there is infection, it is Brody's abscess. But for you have a dead bone here, right? This part is just say this is just your dead bone lying around here. This is your abscess, and this particular event is your Brody abscess, right? So in this point you will have a dead bone, right? This dead bone is known as sequestrum. Sequestrum. Basically, this dead bone is your sequestrum, and if you have sequestrum along with your living bone around it, right? This is your living bone, and this whole component, sequestrum along with you, basically your dead bone and living bone, collectively known as. I hope it's clear. If you want to draw the histopathology, you have to draw just a bone, a dead bone, along with lot of pmin around it, right? So this is your entire pathology of your osteomyelitis. I hope it's clear. So if you want to discuss the treatment, you just have to remove the sequestrum, you just have to clean everything, right? We will discuss this in later session. So in etiology, we want to understand the causative organism. What cause your osteomyelitis, and the most common culprit for your osteomyelitis is, as always, Staph aureus. This person will never disappoint you. Name a pathology and it's there. This is the most common culprit for your infection, osteomyelitis, and it also help in the its subordinates are streptococci, which is also very common in multiple periodontal lesions, and actinomyces. It's also create osteomyelitis. It's a very separate category for these kind of osteomyelitis. We will discuss them in separate lecture. And there is also a tuberculosis. There is a variant of osteomyelitis which is caused by tuberculosis, also known as tuberculotic osteomyelitis. We will discuss them also, that also in separate lecture. Basically, your M. tuberculi, right? There is other some small bacteria you can remember, fusobacterium you can inoculate from these regions. There is also bacteroids and Klebsiella. So these are certain names you can remember if you want, but Staph aureus you should not remember in any possible region. Then there is a most common question for everyone, which is basically classification. Correct. We will discuss each and every variant of osteomyelitis in separate lecture. This particular classification is given by Hudson, and he classified them based on acute, which is basically a short term within 1 month of inoculation, and there is a chronic variant which is more than 1 month. In acute, your infection could be suppurative. Suppurative is when there is formation of pus. So the classification of osteomyelitis, these two classification for this, the First one which you have to write in your exams is Hudson classification of osteomyelitis. He classified them into variant, the acute osteomyelitis, which is within 1 month of infection, and there is chronic variant, which is the infection more than 1 month. According to him, acute osteomyelitis contain two variants, the suppurative one, which is basically there is when there is pus formation, and if there is suppurative, then there is non-suppurative variant. There is another one is progressive osteomyelitis, and there is hematogenous osteomyelitis. Then there is another variant which is the primary chronic osteomyelitis in chronic osteomyelitis, right? And there is Gary osteomyelitis, correct? In this also there is suppurative osteomyelitis and there is non-suppurative osteomyelitis. Then there is something called sclerosing osteomyelitis. Correct. Till that's it for today's lecture. We will discuss all of these osteomyelitis in separate lecture. For now, peace out.